Hello, and welcome to the Build Healthy Places Network video snapshot series. Build Healthy Places is a national nonprofit that sits at the intersection of community development, finance, public health, and healthcare. From this unique perspective, we intentionally position partnerships between these sectors to leverage community-centered investment to reduce poverty, improve health, and advance racial equity. We're excited to revamp our video snapshot series, spotlighting organizations prioritizing community voice and engagement. Today, we are joined by Diane Moss, the Managing Director of Project New Village, an organization improving fresh food access in Southeastern San Diego through resident-led, community-rooted experience that stimulate collective investments in better health and address social determinants of health. Ms. Moss brings over 30 years of experience in managing community-rooted organizations. Welcome, Ms. Moss.
Thank you. Glad to be here.
Thank you. All right, we will just hop right into the interview questions. Our first question for you is, while leading the development of your neighborhood growers network, Project New Village was very intentional with incorporating community engagement. Can you describe the neighborhood growers network and then how you've engaged with your community through this project?
So I should say we came to this realization that we should work with our neighbors. We run a community garden, and in the garden, this is where community people come to grow food together. And we also know that in the neighborhood where we live, we don't have enough grocery stores, we don't have enough access to healthy food. We figured we could make an impact on this by learning to grow or harnessing the skills of those who do grow in a collective, so that we then could be the growers of our food, the distributors of our food. We have a concept we call, it's a placemaking concept, the Good Food District. And it's a geographically defined space. We share, I want to say, a food geography, and we share food experiences. In this geographically defined space, when a grocery store closes, it impacts everyone. And most times when a grocery store closes, it's because they can't afford the rents. So those of us who live here, we want to make permanent assets in our community. And at the cornerstone of that are the people who grow the food. In any food system, they are the centerpiece. And we want the centerpiece of our food system, our neighborhood-based food system, to be the people who live here. So that's the centerpiece of what it is we do. We are currently, next month, which is tomorrow, September, we will be launching a mobile farmers market. Wow. And we launched this market in San Diego County. We have a large number of small farmers, but none of those farmers or addresses are in our neighborhood. So we always keep in mind, we want to make a pathway for people to grow food, to be able to distribute the food and reap the benefits in our neighborhoods. So we intentionally brought in mechanisms so that we could teach folks to farm. And we hope that this is incentive. This truck serves as an incentive for those that you grow the food, we have a way distributed, and that distribution means more wealth to the people who are growing in the neighborhood. So it's clearly a centerpiece of our placemaking effort, the Good Food District.
Wonderful, thank you. So you talked a bit about engaging your community and how these are solutions created and birthed by kind of think pieces and opinions from those in your neighborhood. What was the impact of this approach on your partnerships with organizations like healthcare and other larger entities to provide things like technical assistance, support, and more? And even furthermore, how did Project New Village continue to prioritize your neighborhood's concerns when working with large healthcare organizations?
So I think part of the strength of our approach is that we have a multi-sector leadership team. Those are residents, those are academicians, those are people in the food business. With the government, we meet on a monthly basis for more than a decade. Everyone comes to this table because what we bring, Project New Village, as the conveners, is what they call an authentic voice. We come to the table around our issues, and we invite people to help us from their lens to craft solutions that would be beneficial to our community. I want to highlight one example because when I think about it, it's kind of incredible. So we have a person on our team. So the academicians bring these tools that in everyday life we don't necessarily use, or these terms or these categories for understanding. So language becomes something that's key. So does MAPS when we try to define our strengths and the assets that are happening with a geographic area. So our partner at San Diego State University in the geography department has been really good at showing us maps and how to do storytelling. We have become more the storytellers of our plight and the storytellers of our assets, so that when you come to this table, you can't hijack our agenda. You have to play ball or there's no relevance for you to be there. And people who stay at the table get that, and they come to the table to enhance. That's the sole purpose of being there. So we are very proud when people say that we are an authentic voice for Southeastern San Diego. And I say this is where I live. And so these are my neighbors that I work with every day. So I appreciate that. People coming to the table to bring your strengths so that we can enhance what's happening here. We often have conversations with others that talk about scaling up or scaling. And for some, that means moving to another neighborhood or getting bigger and leaving and or abandoning what you do. Scaling up to us means going from this farmers market we start next month, and in a few years, we want to develop a grocery store from the lessons we learned with the constituents or the people, my neighbors in this neighborhood. So it's just continuing to build, right? To build capacity and to work with those who will work with us. We're also fortunate in this region to have a wonderful San Diego Food System Alliance. They are championing this issue, if you will, of equitable food access, which means we are a poster child, not a product of, but a poster child trying to inform on a regional level what's going on in our neighborhood so that it will get better through our action and active involvement in it.
Wow, it's incredible what a neighborhood and a community can accomplish once their voices are considered. When you think about what the key elements are that make it possible to center community voice and engagement, what are some things that come to mind for you?
So recently, we've been fortunate to become a part of something called a national network called the Equitable Food-Oriented Development. These are like-minded folks. And there are 5 principles there that make all of our work connect. One, the first principle is equity and justice first, right? There are all kinds of problems, and every time we have a meeting, different problems come up, but the lens we choose is to look at this from an equitable point of view. What can we do to make things fair and just? Second, it's place-based, people-based. So these are examples, and this is the work of the folks by, for the people who are in a particular location. And that's a principle. We take the advice of others, and we have processes internally, how we make or see if it's in alignment with the values that we have so that we can move forward with the best practices. And something new for us is using what they call market-based or business strategies. I don't make myself be a business expert, but I do know that if we have economic leakage, that means that we have some money to spend and we're choosing to spend it somewhere else. We want to make it more plausible to spend it where we live so that we benefit from our purchases. Also, community leadership development. Again, for the people, by the people, where we live. So we must put together pathways for people to become leaders in this food justice movement, right? It's not enough that a lead organization is doing work. For this to work, everybody has to get in the game and give what you can. And lastly is community ownership. This garden that we've been working on since 2011, it was a garden that it was city property, right? And we had a temporary assignment where we could use it for a garden. Well, in 2019, we bought the property. What we want to show is that we can have assets, permanent assets that we can enhance. So one of the things we needed to do was to launch a capital campaign. And this fundraising is way beyond, we're a grassroots organization, way beyond what we do. At the end of this year, we will have paid off the debt for this land. And then with that, we can even build a bigger structure, a community hub, we call it. And in the hub, we can have more opportunities for residents here to connect to growing food, selling food, making food here where we live. So I think those are some of the key aspects that make us a little bit different and make it really, we can be focused on what it is that we're trying to accomplish.
Absolutely. Thank you for sharing that. Some viewers may know we initially had a community innovations cohort before our current community innovations for racial equity cohort, and Project New Village was a part of that. We were wondering if you guys had any updates on the work initially started during our first community innovations cohort, like any techniques learned or changes that have been implemented in the organization and how you operate.
So we clearly understand that what we're trying to do with food access is to get to better health, better wealth in the community. And we have plenty of clinics in our community, but through our experience as a grantee, we looked at other ways that healthcare could be relevant to what we do. You know, with this hub, it's an actual physical place where we want to be. And with the hub, we're looking for a partner that's aligned with our values to help us pay for this development. And then so we had to look at healthcare from a variety of ways. So one of the parties that we are looking for, and things are going real well, I wouldn't call it a healthcare institution, but it's a university focused on healthcare training, right?
Wow.
Alternative healing. They have a campus here in San Diego and somewhere else, right? But they don't have a campus where many of the problems are, and they're listening to us. We've had several meetings. So again, redefining what healthcare might mean to work that we're doing, and what is that really? How many branches, how many ways can you look at healthcare? And I don't think we were looking at the university level, those that are teaching people how to be, what do they do? Nutrition is a central point of this university. They work with chiropractors. They're looking at alternative ways to heal. This is a total absence in our community, so it brings value to us. It brings value to our process. And I'm going to say it brings value to what they do too, because this is probably a different audience for them. Yeah.
Yes, thank you for sharing that update. That's really great to hear that this new partnership is kind of formed and you're rethinking the ways that they can engage with your organization and more widely your neighborhood and community. Thank you so much for being here with us today. That concludes all of our questions, and we're just very appreciative of your presence and your knowledge here in learning more about Project New Village. And thank you to our viewers. This is the first in a series of video snapshots focusing on community engagement and community voice and how our organizations are centering those. So again, thank you, and have a great day, everyone.